Good afternoon. Thank you, everybody, for tuning in. This is County Executive Pat Ryan. I'm excited and honored to have New York State Comptroller Tom DiNapoli join us. Thank you for making time, sir.
Thank you, Mr. County Exec, for inviting me.
We're always excited when you're making your journey through that you're willing to stop. So I know we have a lot to talk about in terms of getting your sense of, as we're dealing with the public health dynamics of what's happening, we also need to, and I know you and your team have had your mind towards, okay, what are going to be the economic impacts, the fiscal impacts, the budgetary impacts. So thank you for the work you've been doing and will be doing, and for joining us here in Ulster County. We appreciate it.
It's an honor.
Before we dive in to that, though, I do want to, it's been about 48 hours since I shared updates with folks here in Ulster County, so I want to do a little bit of that, if you'll allow it.
Please.
Cale, if you wouldn't mind throwing up the case slide. So we have, as we expected, particularly as we stood up more testing capacity, we have seen the number of positive cases continue to go up. As of this morning, we are now at 70 confirmed cases in Ulster County. We are beginning to see, unfortunately, the escalation and the steepness of that J curve. Again, I just want to, it's unfortunate that we see this, but I want to set expectations that the more tests we do, the more likely we are to see these numbers go up. One encouraging piece there, though, we continue to see that's out of about 700 tests. So our rate in Ulster County is still around 10% of total tests completed. Only about 10% right now are testing positive. That is significantly below the numbers we're currently seeing in New York City, which is closer to 25%. The other piece of good news, we on Monday stood up our first mobile testing site in the town of Ulster. I want to thank again New Vance Health for getting that up. Our whole county team, from Public Works to our sheriff to New York State Police, Town of Ulster Police, all the healthcare workers putting their lives on the line there and around the county doing this work. We're now able to, the first day we did 84 tests. Yesterday we did 115. We're going to keep ramping that up and hopefully be able to do 250 tests at our mobile site, which will absolutely save lives by letting us better understand what's happening on the ground and protect those who are not positive and treat those who are. What we think, in speaking with Dr. Smith, Health Commissioner, looking at the numbers, we feel like we're about 1 to 2 weeks behind what's happening in Westchester and New York City. And so looking at what's happening there, not at the same numbers, but sort of proportionate, is important, and that's how we're gauging a lot of our planning and thinking, is seeing the spread and how things are happening there. If we can take advantage of that and lean in and try to get ahead of it, I think we have real opportunities to not allow things to get to that point here. So that's our goal. And to that end, if you wouldn't mind throwing up the what we need slide. So yesterday in an interview and in today's Daily Freeman, I talked about, I use the term, the need is at a massive scale. And I understand that hearing that term is not necessarily a comforting term, and I didn't use it lightly, so I wanted to give some sense of what I mean by that and put some numbers up of where we're at now in Ulster County and where I think we need to go based on all the projections we're seeing from the state level, speaking with our hospital leaders. All of our hospital leaders are working tirelessly to ramp up this capacity, and I'm confident that we can get there. Where we're at right now, the key factors we're looking at are hospital beds, ICU beds, and ventilators, and essentially we need to quadruple in all of those categories. That's a significant lift for us to set expectations, but it is an achievable number, and we're working several different angles here to try to do that. Governor CUOMO and his team have been fantastic in these conversations in terms of how do we build more hospital and health treatment capacity. And we're hopeful that as federal resources hopefully flow down, we'll be the beneficiary of those up here in the Hudson Valley, which will be critical to stay ahead of the curve. Lastly, I also talked about some equipment shortages. Not only do we need hospital beds and staff, but we need personal protective equipment is absolutely critical. I'm very appreciative to the governor. They heard our call and answered that call, and I just wanted to share some of the numbers of what we got back. This is huge for us, and we really appreciate it. This will allow us, we were starting to get to a critically low point for supplies, and this resupply that we're getting is going to be a huge boost for us. You can see the numbers here, almost 3,000 N95 masks, over 7,000 surgical masks, 3,000 gloves, 1,200 gowns, 669 face shields. The other really encouraging thing, we've started to see not just support from the state, but our local businesses and manufacturers are repurposing a lot of their facilities and equipment to produce PPE. SUNY New Paltz actually in their advanced manufacturing centers using 3D printers
I've seen that,
to print face shields. So we've got prototypes of that. Several manufacturing partners around have stepped up on masks, surgical masks, and N95 masks. So we're hopeful using all those channels we'll be able to get those numbers up. But I do want to thank the governor for that resupply. That was really critical to us, and we appreciate it. And then finally, before we go on to talk financial and budgetary matters, I wanted to share a few updates on our Project Resilience. And this is a project we stood up to basically say, look, this is a community-wide epidemic with huge socioeconomic impacts. We need a community mobilization to respond. So Project Resilience is about a community fund where we've now raised over $2 million in philanthropic support. It's on-the-ground teams delivering meals, childcare services, and other critical essential needs to our residents. And I wanted to share some numbers, if you don't mind throwing that slide up, please. We have now had just in 4 days, over 850 households have requested some kind of assistance, mostly food. We've delivered 2,775 meals already across the county the size of Rhode Island, using a whole bunch of volunteers and community support groups. We've had 13 local teams in our municipalities established as hubs to deliver meals and distribute meals, and over 90 restaurants have signed up. And one of the added benefits of this is that restaurants we're paying them using that community fund, so they're able to keep their doors open, pay their workers, and they've agreed to do this at cost so they can continue to pay their staff. So we're kind of trying to recreate a local economy, if you will, to help those with need and to support our local businesses. So to see that continue to grow has been really encouraging. And I'm sure you're seeing this in other parts of the state, and maybe this is a good transition to open up. But here in Ulster County, I mean, we have stepped up. Everybody in the county has stepped up in such a huge way at the individual level, at the community group level, at the town level. I'm curious what else you're seeing and hearing just more broadly.
Pat, thanks again for inviting me to participate. And I do have to say we're seeing some of this, but I think what you're doing here in Ulster is really a model for what needs to be happening all across our state. I mean, this Project Resilience in such a short time frame to raise that kind of money to really support the ecosystem of community here in Ulster County, I think is just incredible. I also want to commend you for not only marshaling all the resources of county government, but people are feeling very isolated and left out right now. What you're doing with this kind of outreach with Facebook and radio and so on, again, this is something that's not happening to this extent in other communities. And for everyone who's tuning in or will see this replayed, you're giving important information and you're having people feel connected. And I think that's so important. So I know you're a relatively new county exec, but you are earning your battle stripes pretty quickly.
This was not in the job description.
But you're using the role in the way it should be. You really are the voice for the county, for the region. Ulster, like so many of our counties, is really a larger community made up of a lot of smaller communities. And knitting that all together, especially at a time of crisis, uncertainty. We are in such unprecedented and uncharted times and waters. I think we're all trying to figure it out. We've been through difficulties before. I remember 9/11 and what that did to the New York community. I remember the global financial crisis and the markets tanking 10 years ago. This is similar, but it's also very different. And I think with where we're sitting right now, we're not sure where it's headed. We probably haven't hit the worst of it yet, and certainly the numbers that you're starting to see. And to be prepared for it by getting that equipment is very important. I want to echo your comments about Governor Cuomo's leadership. I think he's been a great leader for us in New York and obviously been looked to as a national leader as well in terms of explaining to people what's going on. It looks like we're getting help from Washington. We're still trying to analyze what it all means, and
everything.
May not be enough. We may need some more, but obviously Chuck Schumer's been in a leadership role there along with our Kirsten Gillibrand and the members of our congressional delegation, and I know you had Congressman Delgado on one of these forums as well. So we know that they're working very hard, but I really want to commend you for providing the linkage to the larger Ulster community, and it really makes a big difference. And I just want you to know that anyway. We said this offline. We could help, and we've got many feet away from us. Ulster's one of Ulster's favorite sons, Elliot Auerbach, who's our deputy controller for local government. And he's certainly a resource, particularly for you and for your towns and villages in the county and cities, to be available to help in any way that we can. So I think we're seeing similar kinds of efforts. I think you're doing it the best right here in Ulster, and that's really a compliment to you. But, as the phrase has been, I don't think overused, we are all in it together, and we do need to share resources, share thoughts, and I think also have a sense of optimism. We're going to get through this. We really are. It's a little scary right now, and certainly for our own families, especially if you've got an older person or someone with a compromised underlying health condition. Make sure, besides the precautions, we're all taking double those precautions and be in touch with your healthcare providers if you see any sign of any difficulty. But boy, to have that mobile testing site here in Ulster, it's all these steps are very, very important. Hopefully going to help this county get through it as quickly as possible.
I know we're going to get through it. I'm 100% sure of that. I agree with you. So one of the things that we've done one, and we're doing another one tomorrow, call with our local business owners. Lots of questions from them about, what does this mean for them individually, but also what does it mean for our economy in New York State? Yeah. You and your team, in a very rapid manner, pulled together some initial assessments of how you saw the impacts. I think people are would love to hear how you're thinking about that. What does this mean in terms of scale and time? I know it's an estimate at best, of course, but
it's an estimate, and it's not pretty. So just to back up a little bit, we started the year in a very strong budgetary and financial condition. The governor put forth his executive budget proposal, and then the legislature and the governor came together on a revenue consensus and found another $700 million in addition. So that was the beginning of March, which is really crunch time for negotiating the state budget. In the middle of this, we got to get a budget done by April 1st. Right. And that's, the charge to the governor and the legislature. I know the leaders are talking with the governor, as we speak about how we accomplish that. So then we get hit with the pandemic and the coronavirus crisis. And the governor reached out to me and asked if we could do an updated revenue projection as they try to finalize the budget negotiations. So we looked at the best data that we had, and this was as of March 13th, which seems like an eternity ago now, right?
Every
in terms
week
of
feels
data
like
point, every day is everything something different, and at least at this point seems to get more problematic. So we looked at that data, which again would still be very preliminary in terms of any economic impact of what we're dealing with, and looked at the economic models that were out there, consulted some of the economists that we consult with when we look at revenue projections. And so we came up with a report to the governor that said optimistically we would be $4 billion short of this is the tax revenue estimate. So the governor's executive budget was $87.9 billion. We were conservatively estimating a $4 billion shortfall. But we also said that should this really trigger a recession or severe economic downturn, you could be talking at least of a $7 billion shortfall, if not more, with really no ceiling to that.
So that's 5 to 10%, which is a huge, at least, right?
And keep in mind we already had budget challenges with Medicaid spending, and important issue in terms of how that would impact on counties. Obviously, a lot of expectations on school aid and the other parts of the state budget that people care about. Well, then on Monday, the budget director Rob Mojica came out with his updated evaluation, and he said the revenue shortfall will be anywhere from $9 billion to $15 billion. And we didn't update our model. I have no reason to dispute his, because we said that $7 billion or higher,
right,
was probably a more realistic picture based on what economic trends would be. So I think the bottom line is this, Pat. By April 1st, we've got to come up with a spending plan for the coming year. That's a very tall order for the legislature and the government, because these numbers are all speculative.
Right.
But we have to assume, at least in the short run, it's a worst-case scenario. Now, the spending plan will be for the entire year. So one would hope when we come back and do the show in March of 2021, we will be through it and the economy will have recovered. But there's no doubt in the short run we're going to see severe economic damage and a hit on the state in terms of our revenue. Let me just mention a couple of other things, not to give you too much of a response to your question, but it's all important. My concern right now as controller is cash flow and paying our bills. And once we get past April 1st, whatever that budget will be, and I'm sure it'll be a bare bones budget in many ways with a lot of flexibility given to the governor to manage finances through the year, and I think that's appropriate at a crisis time. But April, May, June are big months for payments. Particularly May, we pay out about $4 billion in school aid. June, another $2 billion.
So all of our school districts, that's when they receive their
that's normally. So May really is the big month. $4 billion. We'll get through April. May $4 billion. June $2 billion just for school districts. May total expected outlays from the state is $7 billion. Tax refunds. Now, you got that tax filing holiday, which is good for folks, especially if you have a payment and you're being squeezed right now. But that's also going to mean less money coming into the state than had been projected.
Right.
So we're really concerned about a cash flow crunch for the state to meet its obligations in that first quarter. Now, if we look at some of the projections, hopefully as we get past the first quarter into the second quarter of the fiscal year, third quarter of the calendar year, hopefully we'll be through the public health crisis.
Right.
The economy will hopefully start to turn around. But just as local businesses, as you're concerned about, our local families are facing a cash flow crunch right now because of what's happening, the state is going to face that as well. So we're having to juggle a lot here. And the good news is, we do have some rainy day funds. They're not as flush as they should be. We've pointed that out during good times for the state. There is some of this monetary settlement money that still hasn't been designated. You have some other monies that have been designated for certain projects that haven't been expended. We could repurpose some of that money. So, I believe we'll get through it, but no one should think that it's not a challenging time, because it is.
And the state has to operate the same way a household or a business does. We can't, unlike the federal government, create more currency. And so no matter what, regardless of the hit, we have to figure out how to adjust that.
And the state can't go bankrupt. States aren't allowed to, so there's no way that's going to happen.
That's probably a good thing.
Yeah, it's a good thing. But you're right. We can't print the money, or we don't have the Federal Reserve. So we can become insolvent, though. We could perhaps not be able to pay a bill. Now, we're working hard, with the governor's office to make sure that doesn't happen. But, that gets back to questions of short-term borrowing for cash flow, making sure the borrowing is available. The bond market is fluid. So, one of the concerns that we had in the context of the federal discussion was having the Federal Reserve as a backstop for states and localities. You probably have to do some borrowing too at a certain point. Want to make sure that the ability to borrow is there and
not at a rate that's
and in ways that perhaps the Federal Reserve hasn't been used, to have it be an effective backstop for counties, for localities, for states as well. And we're looking at the fine print in the agreement from last night, but I believe that there is going to be something in there that will address that. And if there's not, we're going to keep pressing.
The Senate, you're talking about the Senate.
Yeah, because Maxine Waters had a standalone bill, and we contacted the delegation to urge that they be supportive of that. So hopefully some of what she had been proposing will be rolled into, I think Senator Menendez in Jersey had a similar proposal. So that's going to be key to us in the short term, both for you in Ulster County, but for us in the state as well, to manage our cash flow needs.
And we're now 2-ish weeks, 15, 16 days into the health aspects.
Yeah.
But for Ulster County residents watching, Ulster County taxpayers watching, I've already directed our team to do this same kind of analysis, really building on what your team has done, to look at the revenue impacts, to think about what that'll mean in terms of our operations as a county government.
Look, counties depend mightily on sales tax revenue, and if people think about the property tax, but it's really the sales tax that keeps them going in most all of our counties. And if you don't have, and you're getting into the warmer weather, you'd have more tourism, and if restaurants can only do takeout, entertainment venues, small businesses that are shuttered, I mean, you just multiply what impact that will have. And then, of course, the impact on families. And if you're in a family where someone's laid off, especially our hourly workers, their time has been cut back. Tax bills are due. You can't pay the tax bill. So the ripple effect of this is so significant. And really, the fact that we're not through it yet, right? We're not at the worst of it in terms of the public health crisis. It's very hard to project where it's going to be. Again, we have to have that optimism you expressed earlier. We're going to get through it, and there will be a bounce back, and we'll be in a very different position many months from now. But the next quarter, probably the quarter after that, it's going to be a very difficult time for families. We want health to be protected first and foremost, but economic security, and then for our government to be functioning as well. Tremendous pressure.
Yeah, and we're hearing, many of the comments we're getting are just heartbreaking in terms of, and I know you're hearing them too. Regardless of even, potentially significant cash from the federal government, people's bills are piling up, and we're pushing landlords to extend. Right. We know there's no evictions in the state for 90 days, which has been huge. But everybody's under pressure. Yeah. One of the other things that I'm sure many people know, but some may not, about your role, you also manage our pension fund for all of New York State's. How many? I don't know. I should know the number of New York State employees, but it's a lot, right?
Well, and local government employees. So it's 1.1 million members. So it's a lot of folks. It's all state government workers and local government workers, including many school district workers outside of New York City. New York City has their own plans, and teachers have the State Teachers Fund that we're a part of. I sit on have a representative on the board for that. But we're the largest public pension plan in New York State, one of the largest in the country. And I'm glad you're raising it. So let me say, first of all, to those out there who are state retirees or local government retirees, your pensions are safe, guaranteed by the state constitution, and we have plenty of money to pay your retirement benefits. So don't get nervous with what you're hearing about the market being so off that in any way your pension benefit is compromised. And for those who are working now and want to retire at some point, I also want to assure you the pension fund goes into this challenging time well funded. We're 96% funded, one of the best funded public pension funds.
You've gotten high remarks across the country for your management. So now coming into a crisis,
it helps to be well funded.
In a better position.
But that being said, we're getting hit. We were headed into March we were going to have a good double-digit positive return. Good news for you at local government level in terms of contribution rate, and this all happened. So where are we at? We're obviously at this point down from where we were even a year ago. So the gains that we've had, for 11 months, have been wiped out. I don't want to say where we're at right now because it doesn't matter. What matters, and here's where our challenge comes in as well, Pat. We value the fund on March 31st, and that's the number that sticks with us for. It's not going to be a great number, but again, because we go into it in a strong position, I'm confident we'll bounce back. And not all of the money that we invest is in the stock market. It's a funny thing when the stock market's going really well. People pull me aside and say, "Why don't you have more money in the stock market?
Right.
You're missing out on all these great." Well, in times like this, I know people are going to say, DiNapoli, why'd you have
Thank
so
you.
much money in the stock market? What were you thinking? So, again, we take the long term, but a little under 30% of our investments are in fixed income, treasuries and fixed, and that's done well even prior to the current situation. And then we've got about 25% in the alternatives, private equity, real estate, which are not as susceptible to these, the whiplash of the markets. But obviously, we do have a lot of money in stocks, and so we look at the market carefully. As we're speaking, before we started, the market was up again today, a big uptick.
Right.
Yes, we'll see where it goes. So the key thing for me is March 31st. What will happen then? So let's assume we'll have a negative year. So your concern as a county exec, Tom, what does that mean? Are you going to increase my contribution rate? I already have budget pressures now. What is it? Well, first of all, we get plenty of lead time before we change the rates at all. So we're talking, year and a half off before there's any real impact. And we take, whether it's a very good year or a very bad year or something in the middle, we do a 5-year averaging or smoothing, we call it. So even if we have a negative year this year,
You'll blunt it a little bit.
well, it'll be blunted. And my goal, and you've heard me say this before, has been to keep the rates, meaning what we charge our government employers, as stable as possible, because we already had lowered our assumed rate of return. We already assumed that we were headed for an economic downturn, not the kind of shock that we're going through. And we've already reduced some of our equity exposure prior to all this happening. I'll be honest with you and to your local government colleagues who are out there, there is a chance that because of this, in fact, the rates may start to go up. I certainly am not expecting at this point, nor hoping that it'll be the kind of rate shock that we had after the global financial crisis in 08 and 09, but I just don't know yet. A lot's going to depend on that March 31st number. So we'll continue to communicate, but again, we go into this difficult time in a position of strength. We bounce back more rapidly than many other funds after the 08-09 collapse. But my commitment to our public workers and retirees, my first commitment is making sure your pensions will be safe. And we're going to do everything we can to make sure that happens. Again, for the retirees of today, you're going to get your pension checks. Our staff, many of them working remotely, but they're making sure that everything's being processed in terms of those pension benefits.
That will be reassuring, I know, to over 1 million people, which is huge, and thank you. I'm going to ask one more, and then I'm going to not be rude and not listen, but I'm going to look for other questions coming in here. A lot of, and I talked about it earlier in my remarks, one of the big challenges we're facing is how do we get this equipment and even staff in some cases, health staff and personal protective equipment, ventilators, other equipment. What role, does the Comptroller's office play there? What are you seeing and hearing there? We've heard the governor talk a lot about taking some very creative approaches, which are clearly needed and have been effective. Yeah. How do you all plug in there, and how does that work?
Well, we've had a lot of conversations with the governor's office and the division of the budget. He was granted, appropriately so, emergency authority in the context of this challenge, and more money appropriated by the legislature as well. So we're the payment end. So we've done to date about $31 million in emergency payments, largely for equipment, the kind of equipment that you referenced earlier. We're also tracking the overall expenditures that the state is involved with in response to the pandemic, and we're up well over $200 million right now, and that number obviously is just going to grow. We track that through the state financial system because some of that hopefully will be eligible for reimbursement from the federal government. So we're expediting the payments as quickly as possible. We want to get the material, whether that's the face masks or the ventilators, or whatever the emergency equipment requirements are, the protective gear, and so on. So we're obviously taking direction from the governor's office in terms of what the priorities are. But as soon as we know, what the payment needs to be to the vendor that's been identified, we're turning that around really, really fast.
Great. Okay, that's good. I know one of our concerns is, we're being careful about what we're spending, but how much of that will we be able to reimburse under federal disaster zone? And so your help and our great comptroller here, March Gallagher, and her team have been engaged, so that we're making sure as we're making quick decisions, we're dotting the I's and crossing the T's. And
March has been terrific to work with, so especially at a time of crisis, for people in Ulster to have you as county exec, March as county controller, you can't ask for a better team.
We're in good shape, and I thank her and her team too. I'm going to take a few questions
sure,
coming in.
Sure.
I think it's going to be a mix for both of us.
Sure.
So we had a few questions about folks who are wondering. Kimberly asked how many current cases in Ulster County. For those that joined late, 70, if you don't mind throwing up the graphic again. 70 now confirmed cases in Ulster County. We are starting to see that curve go up. Several different folks have asked about including Jody and a few others here. Sorry, I'm bad at scrolling through my phone. Several people have asked about what towns, a lot of folks understandably are concerned where are these individuals that we know. So what we've decided to do, and I know many others, is we are sharing town level numbers. We are building and hope to have up by, I hope tomorrow or on our actual COVID-19 webpage, a map that'll tell town by town the numbers, so that anybody can go on our website, ulstercountyny.gov/coronavirus, and you can see not just what we currently have, which is just a graph of the total county numbers, but a by town breakout. I know people rightfully want to, know that information, so we're working to get that out there. In the meantime, we are sharing, and we're doing a daily call with every town's supervisor and many other local leaders, and we are sharing the town by town numbers with them. So I know many of them, among the many other things that our supervisors are doing to step up in this crisis, are sharing that information at the town level. So for those asking that question,
people are concerned about data and information, but
right.
Of course, the number of cases are tied to the availability of testing, and
right.
So.
But we are getting that number up.
Yeah, that's good.
By that,
no,
but we got more to go.
That's great. Yeah, very important.
Scott wrote in and asked, "Will New York State Retirement still be processing retirement filings?"
Yes, and if let me give Scott and everyone a number if they have any questions about that. So obviously our folks are working remotely, but they are working. So I'm going to give two phone numbers for people to utilize. 1-866-805-0990, obviously a toll-free number, or 518-474-7736. And folks could also go to our web and click on, just whatever your search engine is, put in New York State Comptroller, or go to osc.state.ny.us, click on the retirement system part of our webpage, choose retirees, and there's a secure email contact form there as well if you prefer to do email. But again, those numbers are 1-866-805-0990 or 518-474-7736. If for some reason that doesn't work, and I assume they will, our main number is 518-474-4044, and someone will answer the phone and get that information to the retirement system folks. But yes, we are processing retirement applications and filing, and certainly, God forbid, if you're in a situation where a member has passed and there's a death benefit question, just give us a call, and we certainly are putting a priority on expediting that. We don't want anybody to be not well serviced, especially at a time of challenge.
Thank you. A few other questions coming in. Chantel asked, what is the wait time for testing? So we have, again, for those joining late, we have upped our testing capacity significantly now. With our first mobile testing site up, we're able to do up to 250 there. We're going to be adding a second one down in Ellenville later this week, and hope that they can get up to that number. The wait time for tests still is longer than we'd like. It's somewhere between 2 and 6 days. And that's really because the private labs, as we bring more testing online, there's more coming in. The lab capacity is growing, but not at the scale we want. So everybody's working all these steps of the system, but we're seeing delays in every step, which I know is frustrating. And we're working nonstop to remove each of those delays. But the answer to that question is it's somewhere from 2 to 6 days. And the other question was how many. The follow-up from Chantel is how many test results are we waiting on? it's a few hundred right now from our mobile testing site and from the test kits that we have as a county. So I'd say probably 200 to 300 is the rough number that we're waiting on. So again, we know we're at 70 now. As more of those results come in, we're seeing about a 10% positive result from that population, and so that's kind of how we can expect things to grow. Several others were asking about how are we doing on personal protective equipment, other equipment. If you don't mind throwing up the graphic, the thank you graphic. We just in the last 24 hours got a huge shipment from New York State. I want to thank Governor CUOMO and his team. We got several thousand or hundred of the different items you can see there on the screen, particularly the N95 masks. That was absolutely critical for us. We were starting to reach a real point where we were worried we're up against the edge, and so that's a big replenishment for us. We're going to need to continue to see those, but that was a big help. So thank you for that. And then on the hospital side, we're working a plan with our local hospitals. We estimate we need to basically quadruple our current capacity for hospital beds, ICU beds, and ventilators. So we are working that and have great partnership with the state on that as well. But we're seeing global shortages of these, and New York has been very creative and innovative in how we're going out and sourcing these. And I will say, the federal government is starting to contribute. They're sending 4,000 ventilators for the state. So that is encouraging.
We're still going to be short, and the governor's been right to continue to press the federal government. Also, reach out for the private sector to respond, because we've been getting calls in our office about folks saying that they have access to some of these supplies and equipment, and we've been encouraging if you have that. And actually, if you don't mind, why don't I mention, in the governor's office, they do have someone designated. If you're an entrepreneur, a business person out there, you got some contacts, and you can provide some of the personal protective equipment or respiratory ventilator equipment. Norman Bierenbaum, his number is 518-491-9510, 518-491-9510. His email is norman.Bierenbaum, B for boy, IRENBAUM, at exec.ny.gov. So if you are someone that has information, access to these products that are in need, donation or for sale, be in touch with Norman Bierenbaum in the governor's office. He's coordinating those kinds of offerings. So.
And someone actually asked to follow on to that.
Yeah.
Can the state do anything to mandate private industry produce a certain number of things? My understanding is that at the federal level,
they have that defense.
Production Act
exactly.
would allow that.
I'm not aware that the state can do it, but the governor can be very persuasive, even if he can't mandate it. So he's certainly been reaching out to the private sector. So and many stepping on the plate. And I love what you said about New Pulse with the 3D printing. 2 years ago, I forgot when, a year ago, I visited the campus. I was very impressed with the kind of things that they could produce. So he's certainly marshaling the research sector of higher education in New York as well.
And we got reports this morning, which were really cool. So the prototype was built in the 3D manufacturing center, but there's a network of individual makers around the area who have their own printers, and they're starting to print the shields as well.
Wow.
So a very, very cool story about leveraging new technology and in this moment.
And maybe if there's any silver lining to what we're going through, some of that may be part of the new world when we get on the other side of this, and maybe there'll be some positive outcomes. We'll learn some valuable lessons and be better positioned, for the future. New products, new technology, maybe some new businesses will come out of this.
I think there's a lot of in crisis is opportunity. I mean, there's a lot of people suffering, but I also think we're gonna learn a lot of things. I know, maybe it's too soon to joke about this, but a lot of people are learning working from home, and I actually think that's going to change our whole country and what work looks like.
We were talking about that yesterday in the office, that it's going to have a big impact. For better or for worse, we can have our opinions about that, but I think people are going to look at a lot of things differently, and maybe opportunities for efficiency. But let's hope we use technology in the way that you're doing it right now to keep ourselves connected to each other.
Yeah.
We have to have a renewed sense of community. I think that's something else. Certainly family, but also community as well. And I always get a little nervous that the more we rely on technology, the less we are connected to each other. So maybe that'll be one of the other benefits of this, that we'll use technology, but also not lose this notion of what community is and how we need to be there for each other.
I think the Project Resilience effort we're seeing here reflects, gives me a lot of optimism about that. Sure, there's always going to be technology, but it's human to human.
And I think the big issue too is going to be helping those small businesses you talked about earlier, making sure they survive through this. There's a real worry. Some folks that may have been doing okay but not great will in fact be able to open up again. And so I think we're looking again at the detail of the federal package, how much of that will be directed to small businesses. The state's focused on that. Economic development, the Business Development Corporation, we help provide some of the money for the small business lending there. I think, as things start to open up again, we're going to have to collaborate with leaders like you and figure out what we can do to help the small business sector.
And the other thing, one of my good friends and former high school classmates runs a great not-for-profit here in the county. Not only businesses, but a lot of our not-for-profits that are critical, especially in this moment, are concerned. So that's something I want to raise to you too. How do we think about supporting them? That's something we're going to think about. But we can't take that for granted. Gig workers, which you mentioned earlier. We have many of them here, creative artists, folks that are, in that part of the economy. So I am encouraged, and I do want to give a quick shout out. Senator Schumer has been incredible throughout this advocating, and the initial reports we're seeing out of this Corona 3 bill. One of the things we were very concerned about was the hospitals, and he's described it as a Marshall Plan for our hospitals and healthcare centers, significant funding that'll really help meet some of the needs we've seen here, and I know statewide.
We're lucky he's in a leadership position, but as we read the fine print, my guess is we're going to have to go back for more. I think that's going to be one of the challenges, and hopefully the country has realized that New York particularly has real pressure given what's happening here, and this may be a harbinger as to what some of the other states are going to face. So sometimes that somewhat anti-New York attitude that sometimes is out there, hopefully that's going to dissipate, and other states will look to us and realize they've got to learn the hard lessons from how New York is managing this.
Yeah, and I want to take, I know you need to run, maybe take a few, we'll do a lightning round here because we got a lot of questions we didn't get to. One that we've heard several times, I know there's been some discussion about second homeowners and folks moving around the state. We're a big second home community here. Denise wrote, I'd like to know how we can keep New York City corona positive people from leaving the city, going to their country homes, but not staying inside and quarantining themselves. It's a free country, but I don't want your virus. I think a lot of people feel that way.
Yeah.
I mean, we've had some of our surrounding counties have been very direct about saying kind of don't come, stay home, or stay out. We count every one of our residents and taxpayers as an important part of our community. So obviously, especially those that have symptoms or have been confirmed positive, you should stay in place for everybody's safety. But for folks who are second homeowners coming up here, we ask you follow the same rules that we're asking everybody to follow, which is stay home, social distancing. Every one of us are empowered to actually keep the community safe. So regardless of what your address is or your zip code or where you're coming from, everybody needs to follow those rules.
And I think that's the key message. My home is on Long Island, and a lot of city folks are coming out to their second home out in Suffolk County. Look, if dealing with this would be as simple to say everybody in New York City stay in New York City and then we'll all be fine, then that's the virus doesn't pay attention to borders and boundaries.
Our arbitrary county lines
don't respect, and we already know there are cases in every county. So I think what you said is the key thing. Wherever you are, wherever you've been, follow these very, very clear guidance in terms of not only social distancing, but staying in your own home, minimizing any contact with anyone, keeping an eye out for vulnerable people in your families or in your neighborhood. I mean, I think that's the common sense for wherever you're going to be located. Look, well, what did they say yesterday? Anybody that's been in the New York metro area, not just New York City, self-quarantine for 14 days. Well, how do you track who's been in the New York metro area, and if you were in contact with someone that was in northern New Jersey or west? I mean, some of this becomes very difficult. So just follow the precautions, that Pat just laid out. Wherever you've been, wherever your home is, just follow that. That's the best advice.
Yeah, think about others. If
Yes.
we all follow that, we're going to be in a much better place.
Yep.
Last thing, and I'd like to get your input on this too. We're getting a lot of questions about schools. We opted to close at a few counties upstate closed our schools a few days ahead of the statewide issue or decision, and we're now coming up on the end of what was a 2-week clock, and a lot of people, understandably, parents, teachers, everybody's wondering what we're going to do there. I want to get a final answer out in the next 24 hours on that. We are consulting with the state.
Yeah.
We want to give predictability to folks, but we also want to continue to see how things are progressing. As I've said, right now, we are seeing the numbers go up. I think almost all public health experts, I know Dr. Smith here in Ulster County, our health commissioner, feels that we're not there yet. But, we're going to have to work with the state on that because the governor's put in now a statewide decision. So we will ask for clarification to get people predictability on that. But the other thing,
I'm not sure you get an answer in 24 hours though, because everybody's trying to figure it out.
Yeah, we're gonna try.
Yeah,
I'm impatient.
Yep, that's good. That's good.
For better or worse. One of the other pieces though is our schools are under tremendous pressure.
Sure.
I mean, you alluded to this earlier.
Yeah.
Schools have budgets coming up. Schools are expecting significant, funds coming in. They're worried about, the governor waived this 180-day requirement for reimbursement, but they're concerned, are we going to be able to keep things going?
School budget vote's supposed to come up in May.
Right.
School Board Association already said we need to delay that.
I know that your office has a lot of resources and help for those folks. What should school district or school board members and administrators do? Can they reach out to you all for help on that?
Yeah, I mean, I'll volunteer Ulster's own Elliot Auerbach in that regard. So
that was my cue up for
518-474-4037.
Is that his home phone?
It's the number he could be reached at. I don't want to get in trouble with his wife on
Judy
that
would
one.
not be happy about that.
518-474-4037 or email Auerbach, EAUERBACH @osc.ny.gov. So we'll certainly give guidance. Obviously, it's an interplay of the governor and any legislative action, the Board of Regents, the Commission of Education. So there are a lot of other decision makers that will play a role in this, but we will certainly share whatever updated information we have as we navigate through this. And certainly, as I said earlier, we're going to be working with the second floor to make sure the school aid payments, that we have the money there to have those come in May and June, those big payment months.
Great. Well, time flew, and I know you need to run and other people have stuff going on.
Well, you got me out of Albany for a little bit, so thank you for that.
Thank you.
Thank you,
it's
County
always a pleasure to see
No,
you.
thanks for what I said earlier. I don't want to overstate it, but it's true. At this time of crisis, people are feeling isolated, and you're providing this wonderful venue for communication, for community, for sharing. It's very key, and Project Resilience, wonderful. I mean, Ulster County is a great community. I know so many of the people here, and the kind of response that you've gotten thus far, wow. Pat yourselves on the back. So you're really great. We're going to get through this, and I look forward to working with your county executive to make sure Ulster gets through it as quickly as possible and come out of it even stronger than you were before. So thanks, Pat Ryan, for including me in this discussion.
No, thank you for your leadership to Elliot Auerbach and your whole team. It's really important, I think, for people to know that there are smart minds thinking about the medium and long term and short term financial pieces here, because we are going to get through this, but we need to be able to then be resilient and pick ourselves back up and get moving again. So I know it makes me feel much, much better to know that you both and your team are there thinking these things through, really using science and data to help us inform what's going on.
Well,
so
anyway, we can help. Call on us, please.
All right. Thank you. Thanks, everybody. We'll continue to keep you all updated Our website is always a go-to, ulsterny.gov/coronavirus. Our COVID-19 hotline, Ulster County hotline, is 845-443-8888. If you need information about testing, if you have questions or are experiencing symptoms, you can call that number and get help. And I just want to again thank my Ulster County government team. I could go on for 3 hours just thanking all the individuals who have stepped up, working basically nonstop for the last 2+ weeks. And I know there are many other dedicated public servants across the state and the country doing that, as well as healthcare workers, grocery store tellers and stockers, many people who are everyday heroes that are making everything run as best as we possibly can. So thank you for that, and stay healthy and stay safe, and we will speak with you soon.